All right. Welcome everyone to today's session, Mental Health and Wellbeing in Health Center Communities. My name is Martha Alvarado, the Manager of Online Education for MCN. And let's go ahead and go to the next slide, Elizabeth. Just a reminder that this session is being interpreted into Spanish. So if you want to listen to the Spanish presentation, just at the very bottom of your screen, there's a little globe-shaped icon. Click on the icon and select Spanish. Let's go to the next slide. Likewise, if you want to see the Spanish PowerPoint presentations at the very top of your screen, there are two little tabs, one labeled English, one labeled Español. Just simply click on the tab that has the language that you want to view. Let's go to the next slide. Really quickly, I'm just read this disclosure. We have no relevant financial relationships that relate to this presentation, nor do we have any relevant financial relationships with ineligible companies whose primary business is producing, marketing, selling, reselling, or distributing healthcare products used by or on patients. Let's go to the next slide. Thank you. And let's see. So our work at MCN, as you all know, we do quite a bit of resource development. We have many comic books on many different subjects. We provide education such as we're doing today. We are involved in research. We do bridge case management with our health network program. We have a very robust worker health and safety arm of MCN. We provide support for provider well-being as we're doing today. And of course, we do a ton of peer networking. Let's go ahead and go to the next slide. Presenting today, we have Jessica Calderon from our Witness to Witness program and Pamela Secada Sales, who will also be presenting. And with that, just so I don't take up too much time, we have a lot of material to cover. I'm going to go ahead and hand it over to Pam. Thanks, everyone.
Thank you, Martha. Hi, everyone. I'm Pamela Secada Sales. I use she, her pronouns. And along with my colleague, Jessica Calderon, we will be presenting today's webinar. So these are the learning objectives for today. And just to note that you might notice some minor changes to the objectives and also to the title that we just, the opening slide that we had, minor changes compared to what was originally advertised. However, the core topic will remain the same. And today we're going to be presenting both ideas and some practices. And so for the next 45 minutes or so, we encourage you to practice what we call double listening, and that is listening with two different intentions. The first intention is to listen for those ideas or practices that could help you better support your clients, your patients, or others. And then also which ideas or practices could support your own well-being. And our hope is that you will find value in what we're sharing for both your work life and your own personal life.
Can you speak up a little bit?
Speak up? Sure.
Thank you.
So who is at risk of having a mental health disorder? So a major global study that took place over 20 years ago, but it was conducted by the World Health Organization, interviewed over 150,000 people across 29 different countries. And what they found was that by the age of 75, half of the world's population will experience some type of mental health disorder. So we just pause for a second just to consider that for a moment. So what that means is that in any room or in any gathering that you might be in, it's very likely that someone that's sitting next to you, or it could even be ourselves, will experience some type of mental health disorder at some point in our life. And that same study identified some of the most common mental health disorders. For men, the top two are alcohol use disorder and major depressive disorder. And for women, the most common were major depressive disorder and some kind of specific phobia. And for both men and women, the conditions began early in life, around by the age of 20. So let's begin just with some basic information and grounding ourselves on who we're going to be talking about today. So in the US, there are about 2.4 million farm and dairy workers, and another 133,000 approximately working in meat, chicken, and seafood processing. And about 3% of those workers are likely to be between the ages of 14 and 17 years old, which means that there are young people and teens that are also part of this workforce. And in 2021, MHP Salud surveyed health centers that serve the MSAW population to learn about the different mental health issues that are being experienced by this population. And the most common mental health conditions reported included depression, generalized anxiety, substance abuse, PTSD, and social anxiety. And the most commonly reported mental health issue being depression at about 99% reported. And the same survey identified certain pathways that contribute to poor mental health in the MSAW population. This is not an exhaustive list, but it does give us just an idea of some of the conditions that produce these pathways that lead to poor mental health. So those are things like poverty, housing insecurity, social isolation, and language barriers. And even just basic communication with employers or navigating systems for services and resources can be a significant barrier adding to chronic stress. And then also environmental conditions also matter. Extreme weather like heat waves, natural disasters, wildfires, all that adds to the physical and emotional stress of this population. In fact, MSAWs are 35 times more likely to die of heat-related causes than any other type of workers. And exposure to pesticides and fertilizers also impacts the physical and mental health, and they also contribute to anxiety, depression, and then also cognitive challenges. And beyond just, excuse me, too much. And beyond just current working conditions, many MSAWs have also experienced significant trauma before or during their migratory journey for work. And so this can include violence in their home country, displacement due to that violence, poverty, or natural disasters. And all of this leads to chronic stress. And then MSAW women, who make up about 1/3 of the agricultural workforce, also face specific and often severe challenges at work. Reports have documented high rates of sexual harassment and violence that often go unreported due to fear of retaliation, fear of losing their job, or just disbelief and denial that this is happening to them. And so these experiences have lasting mental health effects, especially when combined with other stressors like the ones that we just mentioned. And we know that exposure to sexual violence and harassment increases the risk of anxiety, depression, and emotional distress for this group. So what can providers do? I'll hand that over to Jessica.
Thank you, Pam. Yes, so there are multiple depression screening tools that primary care physicians, psychologists, counselors, and psychiatrists can use. Depression screening is a tool used by healthcare professionals to identify individuals who might be showing early signs of depression or who are already experiencing some of the symptoms. Those screening then provide a diagnosis, but it helps to determine who might benefit from more in-depth mental health evaluation. In short, they serve as an important first step in connecting people to the right healthcare. And for example, the patient health questionnaire, the PHQ, is a simple, quick self-report tool used to screen for depression. Both the PHQ-9 and the shorter version, PHQ-2, help assess the severity of the depression symptoms based on a criteria that comes in the DSM-5. The PHQ-9 includes 9 questions, and of course, as the name suggests, PHQ-2, the 2 has 2 questions. The first 2 questions relate to the mood and the intensity of the activities. And let me show you an example of the PHQ-2. Like I said, it's 2 questions. And the first one is little interest or pleasure in doing things, and you have the scale of to answer as not at all, several days, more than half days, nearly every day. And the second question is feeling down, depressed, or helpless, and also the same answers. Just like for depression, there's also different tools for anxiety. Different in different mental health conditions. And the main thing is trying to identify any condition when you get the early symptoms or the early signs, so the person can get more support and more help. Healthcare providers use a brief screening tool to detect symptoms for anxiety and determine who might need more of the future care. And one of the screenings for anxiety is this one that we see on the screen is generalized anxiety disorder. It's 7, and it's a 7-item scale, 7 questions. It helps assess severity and frequency of the anxiety symptoms over the past 2 weeks. The questions reflect core anxiety experiencing such as worry, relentless, and a lot of difficulty to concentrate. Like the PHQ tools, the GAD-7 is based on the DSM. The diagnose criteria is a quick way just to do the first step, right? It's not to be providing diagnosed to people. There's also a variation of the GAD-7, and it's a GAD-2, which is also 2 questions, very brief, just so you guys know that. And for post-traumatic stress disorder, it's a mental health condition that can develop after experiencing or witnessing a lot of times a traumatic event such as violence, displacement, or some workplace abuse. To identify individuals who might be experiencing PTSD, healthcare providers use the standardized screening tools. And sorry, for the PTSD screen, also is coming from the DSM, like we were mentioned. It's a 5-item questionnaire. It's used in primary care settings. And a lot of times when the patient answer to this questions more than 3 yes, that is it's suggested to have more of the evaluation. A lot of times we let PTSD go by for so long, not being diagnosed. And especially with the community that we're talking about today, we tend to say that is to normalize it and to think, oh, I'm sleeping a little less, and in reality, is they're not sleeping enough. Or, for example, the stress levels, and they tend to go higher, especially with the environment and being hypervigilant. I think it's a good practice not to get used to it, or normalize certain things. We also notice that people tend to say, oh, it's the age. It's not necessarily the age. I think it's just a good practice to do more of an open mind and check in. For substance use, including alcohol and drugs, can be both cause and consequences for mental health challenges. Early identification is crucial to provide timely support to prevent future harm. Healthcare providers use screening tools to detect risk substance use, even when the patient hasn't openly shared that information. The alcohol use disorder identification test is a 10-item questionnaire developed by the World Health Organization, screening for hazardous and harmful alcohol consumption. The drug abuse screening test is a self-report instrument that screens for drug use, and this one is excluding the alcohol and tobacco. And identifying possible drug-related problems and need for future assessment. That's how DAST is used. For the MSA workers, they face different stressors, and that might increase the risk of using different coping mechanisms to deal with the stress. On this website, they have different resources, not only in English and Spanish, but a lot of times they have in other languages. Definitely to you, Pam.
Thank you, Jessica. So now let's talk about adverse childhood experiences, also known as ACEs, and I'll be referring to adverse childhood experiences as ACEs from now on. So ACEs are events or circumstances that may be traumatic to a child during the first 18 years of their life. And there are 3 categories of ACEs: abuse, which can be physical, emotional, or sexual; neglect, and that neglect can be physical, such as not having food or proper shelter, or emotional, like lacking affection or support; and household challenges that include experiences like growing up in a home where someone has mental illness or is using substances. There's domestic violence, or also that, it's a home where there's the parent that's incarcerated or separated due to divorce. And what we've learned is that ACEs are not rare. And in the US, 64% of adults report at least one adverse childhood experience, and 17 report about 4 or more. And research has shown a clear dose dose-response relationship between the number of ACEs a person experiences and their risk for a wide range of negative health outcomes in adulthood. The more ACEs someone has or experiences, the higher their likelihood of developing conditions like heart disease, cancer, um, poor self-related health. And this is where the ACEs screening tool can be helpful because it gives us a way to understand the level of adversity someone may have experienced so that we can better consider the potential impact that those experiences have on their health and their well-being. And it's important to remember that the tool is not used for labeling or for diagnosing, but it's just to get a better understanding and to support prevention and also healing. And like I mentioned, ACEs are common, but it's important to remember that they are also preventable. And so, yes, they're associated with 5 out of the 10 leading causes of death in the US, but research has shown that preventing ACEs could help prevent millions of cases of adult depression and heart disease. And so how do we prevent ACEs? We do this by strengthening supports for family, promoting the kinds of community conditions where adversity is less likely to occur, and ensuring that children and their caregivers have a strong start to life. And so the Benevolent Childhood Experiences, or BCEs, it's a checklist and it's a related tool. While ACEs screening tool tells us about adversity, the BCEs helps us recognize the positive protective experiences a person may have during childhood. And these can be things like having a caregiver who makes you feel safe, having good friends, or the opportunity to have fun, are experiences that can help buffer the effects of adversity. And so promoting these positive protective factors is just as important for long-term health and well-being. Let's talk about grief for a second. Grief affects us in many ways, not just emotionally. It can lead to changes in our sleep, our appetite, our energy level, and our moods. It impacts both our mind and our body and vice versa. And grief touches many aspects of our life. And yet sometimes we unintentionally pathologize grief. We treat it as something that needs to be fixed or needs to be treated, when in fact, it's just a natural expected response to the loss that we might be experiencing. And there are many different types of loss that we're all experiencing during this time right now. And while it can be painful and disruptive, grief is not an illness. It's just a process that we must go through, and it does take time. So how can you help your patients? This is where we're going to ask you to do the double listening once again, because I understand that there's a lot of patients that come into your exam room, but let's just say you have someone who's feeling a bit anxious or a bit down. Of course, not everyone that's feeling this way is going to need a referral to a mental health specialist. And sometimes even those referrals or getting an appointment takes a long time and it's not as quick and easy as we want it to be. So what can you do in the meantime to help? And we'll share some simple things that you can try. So the top 3 recommendations we have, and we're sure you've heard them before, are sleep, exercise, and nutrition. Sleep is one of the most powerful tools we have to protecting both our physical and our mental health. It strengthens our immune system, it enhances cognitive performance, and it helps us manage emotions and stress. We also need to keep in mind how long and how well we are sleeping. The consensus is that adults should aim for about 7 to 9 hours of restful sleep per night. And promoting good sleep hygiene can make a big difference in our overall well-being, especially for workers who face long hours and demanding work. And while farm work is physically demanding, it's not the same as the type of physical activity that offers different and important health benefits. Physical activity like simple exercises, like stretching, all of that can improve health, strengthen bones and muscles, and support brain function. And they also can help prevent chronic disease. It also improves mood, reduces stress, and enhances our quality of life. And all of these are important in a workforce that faces significant physical and mental demands. Nutrition is also really important, but we recognize that this can be especially challenging, especially for this population. So nutrition is foundational to both our physical and our mental health because it provides energy and nutrients that our body needs. It strengthens our immune system, it supports muscle recovery, and it influences mood, cognitive function, and stress resilience. At the same time, we recognize that many MSAWs face significant barriers to accessing healthy foods, and those can be ranging from the isolation from grocery stores, lack of reliable transportation, and also often just housing and kitchen accommodation needed for food storage and preparation. And this makes supporting nutrition an even greater priority for promoting mental health and well-being.
And like Pam mentioned, we recognize there are different reasons and there are different factors. For example, the healthcare service might have limited ability, which can have an impact. And maybe the appointment and the time waiting for your appointment can be longer than expected. Service hours might not always align with the patient's ability, and patient might face a complication in following through the referrals due to different factors. And now we want to move on to some practical suggestions. There, we will dive into actionable steps that you can take and make a difference. We know that a lot of times people are like, yeah, I understand the theory and what is happening, but I want to be able to do something. So this is another thing that clinicians can do. And they can advocate for these two premises, and it's small change can have a big impact. And also having someone to talk to is very important for people well-being. We can always think about how much lighter we feel after we have a conversation and we're able to share things with another person. Could be a friend, a family member. And for example, the grounding techniques can be very effective in helping us when we're overwhelmed with strong emotions. And this is a list that we can do to regain some of the control and bring ourselves back to the present during stressful times. We can count to distract ourselves. We can wiggle our toes. We can use different breathing techniques or even change the environment. Sometimes just moving from one room to another can help us to stretch a little bit, to feel better as we do that change. And we think it's good and positive to think about a grounding technique practice as a tool to reduce the stress and reconnect with the here and now. There are some quick ways to feel better or right away. For example, helping someone. I invite you to just close your eyes and just think about the last time that you helped someone and how that made you feel. Maybe there's a smile, maybe there's like, okay, I'm glad that I was able to help and support someone. It can be different ways. It can be just by listening or, doesn't need to be something big. Another thing that we can do is to laugh. Uh, there's a lot of research that prove that laugh can help feel better. Another one is writing down two things that you're grateful for. When we're having this big emotions in that moment, just to be able to write, having that connection of what is the two things that I'm grateful for, it can help us just to ground ourselves. Um, Jumping jacks, napping. I actually, I'm a student too, so in between work and going to school, I think taking a quick nap, it doesn't need to be a long nap, tends to help me and just like, okay, time to get back, or here we go, and be present for, in this case, my classes there later on the day. And giving, receiving, or even watching a hug can be also a good way to feel better. I prefer to give and receive hugs, but I understand that watching someone getting a hug can also have an impact in my well-being. But also, if you think about technology, just pulling up a video of a baby laughing or a cute animal, just make us smile, right? So we can use that to our advantage. Now, let me go back to this one. Let me ask you and invite you, everyone, to put something in the chat for me. Which techniques have you guys used that you feel that right now is working for you? Just so we can interact a little bit. Is there any technique that you're using lately? Okay, I see. Ooh, yes. Thank you for sharing those. We noticed that a lot of times you can find one technique, but doesn't mean that the same technique is going to help the same person to ground themselves every single time that it's needed. So trying and practicing different grounding techniques, it will make it easier, to the point that if you're having a tough time, you you can try your uh, number one technique. If that doesn't work, you know already that there's a second and maybe a third technique that you can try. Depending on the emotions, a lot of times it might take you a little longer to feel better and to be able to incorporate yourself. If you're like, for example, in a meeting at work, or if you're with a lot of people and you just need to do a grounding technique, we always recommend or suggest that you can go to the restroom. You can do a butterfly hug. You can do the breathing exercise there, maybe a jumping jack, maybe a combination of all of the things that you can do there. And when you're ready, you can get back and incorporate into the activities. Thank you so much for sharing. for the people that maybe had a little harder time answering that question, don't worry. You can use one of the techniques that were suggested on the chat and see if that works for you. And now moving to the importance of having fun. It is like having fun. It is like giving your strong emotions like a little break if you think about it that way. While the MSA work is demanding, incorporating maybe some fun, um, the community activities can significantly improve mental health outcomes, encourage small moments of joy in everyday life, even in tough conditions, can make a big difference in overall mental and emotional well-being. And I mentioned this in one of my classes. We were watching a documentary, The Clown Bed, and the documentary is about the U.S. Veterans with PTSD who find healing by bringing joy as clowns in Latin America and different countries. Their journey highlights how service and connection can transform life and showing that healing purpose and service can come in many forms. If you have time, if you like documentaries, I will say you made me cry, but at the end, I was like a really good documentary. And it makes me think about how important it is to have fun. It doesn't matter what type of work that you do, the situation that you have. I know sometimes it's hard to enjoy those moments when you know other people are having a hard time. But if you're okay, then you're gonna be able to help others and support them in a better way. So it's not like you're being selfish for having fun. Give yourself that permission. And I'm gonna pass it again to Pam. And you're muted.
Thanks, Jessica. Yep, thank you. So cyclic sighing is another strategy that we like to suggest. It's a slow, intentional breathing technique that have been shown to reduce the physiological and psychological stress that we experience. It can lower heart rate, reduce anxiety, and improve overall mood. It's evidence-based that's easy to integrate into our daily life. And this is just a 1.5 minute clip of what cyclic breathing entails. And if you are able to and willing, you can follow along. It's about a minute and 30 seconds. And I apologize, we only have it in English. Maybe Martha, can you hit play on that?
Let me record, or let me share with sound. Give me 1 second.
Or we can just also share the link. The link is embedded into the PowerPoint that we're going to be sharing with all of you all at the end of the presentation, so you'll have access to it. No worries, Martha.
Okay, thanks, Pam.
Yeah, thank
Should I
you.
stop it?
Yeah, I'll just go on to the next one.
Okay,
Thank you.
sorry.
No worries. Thank you so much. So research has, over the past 20 years, shown that regularly expressing gratitude can also significantly enhance our well-being. And expressing gratitude is not just saying thank you. It's really a conscious, ongoing practice of noticing and appreciating all the good things in our lives, even during challenging times. And gratitude has been shown to improve sleep, encourage more physical activity, support cardiovascular health, and improve mood and hopefulness. It also plays an important role in building strong connections with family, friends, and teams through mutual appreciation. And self-compassion is just as important as compassion that we offer to others. And it's something we all need because I'm sure we've all experienced those moments when we get really down on ourselves. Maybe we haven't met our expectations at work, at home, in our personal life, or we just feel that maybe we disappointed someone else. That's where self-compassion comes in. And there's three key components to that. The first one is self-kindness, treating yourself with the same care and understanding that you would offer to a good friend, especially in difficult moments. The second one is just common humanity, recognizing that suffering and imperfection is part of our shared human experience, and we all struggle sometimes, and we're not alone in that. And then the third one is mindfulness, being aware of our thoughts and feelings without getting swept away, being overwhelmed by them, or trying to just push them down and not feel them. It's about being present to what's happening and being present without feeling overwhelmed. And the research backs this up because studies show that practicing self-compassion reduces depression, anxiety, and shame. It also increases happiness and life satisfaction and reduces the tendency to compare ourselves negatively to others. And for many of us who are in caregiving roles, many of us here today, it also helps reduce symptoms of burnout. And self-compassion is associated with better physical health, stronger immune function, and even improved sleep quality. And practicing self-compassion is just a small step that can make a big difference and can truly support our long-term well-being. And spending time in nature also offers really well-documented physical and mental health benefits. For example, it can lower cortisol, which is a key biomarker of stress. But this brings up an important opportunity when we think about MSAWs, because they are immersed in the natural environment, but we should try to encourage ways to experience and appreciate that beauty of nature as a source of rest and reflection. Creating a separation between work and restorative time in nature is worth encouraging. And this doesn't have to be nature going to the forest. It can be, just being in our backyard, in a neighborhood park, just walking down, noticing the sky, the colors. Those small moments of mindful connection with the natural world can have meaningful benefits to our well-being. And we're going to be also sharing some resources in the next couple slides here that we'll be sharing with the PDF as well. And these are all live links that you'll be able to click on, and it'll take you right to the resource. So thank you very much, everyone. That concludes this presentation. We do have an evaluation. I do want to mention that you might notice that the title of the evaluation could be a little different than the title that we had shared, but it is the same evaluation. If we can just stop the recording now.